This is Maria Santiago from Home Health Aide Training Institute. I am the founder and administrator of the school. We are located in Westbury at 321 Post Avenue. And my three sons, Michael, Mark, and Matthew.
Hello, my name is Michael Thomas. I'm the CEO of Home Health Aide Training Institute.
Along with our teachers, Gil Harry and Angela Trotman and Jesse, has created the school.
I want to say thank you to everyone for coming. And should I stand right here?
Today we had a ribbon cutting.
And I want to thank God most of all for this beautiful day. And I want to thank all the angels in heaven. Thank you for coming to the chamber. Today we're going to cut the Home Health Aide Training Institute, located at 321 Post Avenue in the community in Westbury. We're going to cut the ribbon today. Ready? Yay!
And we had a few people that was of great interest that showed up.
As a whole, I'm here to support Maria during her ribbon cutting ceremony. She has a wonderful team and she's going to do great things for Westbury, training the home health aides, which is a very honorable and a great thing to do. And it's going to be great for the community and for Long Island in general.
I'm Dana Arnone. This is Mildred Gallery. We are from Reliance Home Senior Services. I'm a registered nurse and owner of the company. Mildred is our recruiter, and Mildred is the one who helps us find all the wonderful aides to help our seniors in the community.
So we're here today to support the Chamber and the ribbon cutting for interim health care.
We are totally honored and pleased that this business has opened up here. We all know that getting older is not easy.
We're very pleased and thankful that they've set up shop here in Westbury.
We are neighbors of the Home Health Aide Training Institute, and I'm here today to congratulate Maria on her grand opening and to offer any support that United Healthcare can give.
We're fortunate enough to reach our older years that, you know, healthcare, especially for elders, is critical in today's day. So to have a business like this in our district, we're very grateful for that.
Oh, it's vital. It's definitely something that is needed. The elderly deserve to have the care. Quality care is important to have, just like quality health insurance. So it's vital.
As we are in an aging society currently, and what the elderly do need is some people that could come in and help them, some people that are honest and that want to do the right thing and want to help them get through those years that they're still living at home and do need an aide to help them with their daily activities.
We are here to congratulate Maria on the grand opening of her school. We are very proud to be associated with her. We are blessed enough to get a lot of our home health aides from her, and a lot of our aides that we get from her have the same mentality and the thought process that she has, where they're coming from a kind place. They're coming from a place that want to help the seniors in the home. We're all coming from the same place as well, where we put God first, and hopefully the people that come here will be coming to work with us in our company and will help us to keep our elderly seniors at home safely and where they want to be.
We would look for people that are kind and caring and competent, people that are willing to care for someone like they would their own loved one. This job isn't for everybody. This is a job where you have to have a compassion, you have to have empathy. Without that, this isn't for you.
Well, I also work in the recruitment department, and we actually have an association with the school, and we're building that in the community. And we always like to have establishments like this and communities to help the population out. It helps them live a certain way that they used to live, and it continues that growth. And you know, I think that we all believe that people should have a certain quality of life.
Our association is that Maria and Dr. Jackson reached out to us wanting to connect their students to get a physical with us. So we're going to be the medical center if that's the student's choice, that our doors are open to receive them and to be able to help them out with that part of their journey to complete their training process. So any physical that needs to be done, we would be able to accommodate. I think in this community that we are in, it's a big major workforce with this population. So I think this is going to speak volume in the community as well as in the areas of both Suffolk and Nassau County, that we need these kind of workers to help support our elderlies. They are getting older because they are, having a longer life expectancy. So that support, to have someone guide them and help them and be their companion, I think it's crucially important.
Well, when we need high quality, high trained caretakers for our clients, we know to call on this agency and Maria to find the people who we need. We spend a lot of time and effort handpicking the right people for the right case, and it's a perfect place to go to. Aging population has a lot of challenges, and they need high quality caretakers. And if anyone to come here and visit this particular training facility, they'll see it's pretty clear the type of detail that's being trained and covered, and the pleasant atmosphere and the great equipment that's here, so everyone could try and use and practice with, because that practice is critical to having good quality care in the home.
What brings me here today is I'm the representative for Interim Healthcare. I'm their agent, and also for the Home Health Training Institute, and I provide benefits for the staff members here. It enables people to have home health aides in their home, to stay in their home and maintain their quality of life, and just to, for them to maintain their independence.
Oh, it's been a wonderful experience. I had so many beautiful experiences with all the students that are coming into the class. Yeah. Most of the real moments I spend with the students in the clinical area with the patients, those are the best. When I see the students being able to practice what they learn in the classroom.
I worked in home care for more than 20 years with Northwell, and I met quite a few home health aides in my day in the homes. Some of them were well trained, and some of them, needed a little brush up. So that after I retired, I thought this would be something I want to get into, because I want them to give my clients the best that they can to help them stay independent in the community.
Wonderful, wonderful experience, one of the greatest experiences. When our team was, when we completed our class, our team was very excited. When we were taking our pictures together and we got together, we felt it was so good that we have what we have accomplished.
Has worked with John for quite some time, and as well, Etta has worked with Mrs. Gregston. They're all graduates from our school. Elfrida, would you say something about John?
He's like a father to me.
Okay.
And I enjoy working with him as long as he enjoys working with us.
Well, I can say the same thing. Elfrida is very much like a mother to me. She takes very, very good care of me. I think certainly one of the big things that helps over and above all of this is a lot of what the pastor said before, is that God is really a very, very much an important part of my life. As a retired church organist, I have an organ in my house, in my own chapel, and I chant the divine office 4 times a day, and I've got probably hymnals of every Christian denomination I can think of, and I use all of them. So I really get a really lovely cross-section of church music, and the faith in God really keeps me going. And Frida sings to me when I'm not singing, playing the organ myself. So it really just is a wonderful thing. In many ways I feel that I'm a cripple, that my quality of life is a lot better than it's been in the past. And I remember when I was in the hospital, before I met Maria, when this all started, they kept telling me, well, you're never going to go home again. You're going to go to some nursing home, and then you're going to be in a box. And I'm saying, no. So if I want to die, I'll die in my house, And then everything just worked out, and, I'm really enjoying my life. And she's wonderful with me.
Since I've been with Carol, they come like family to me, and she's very quiet. She's not talkative. You have to give her everything that she wants. Just think about what she wants and give it to her, because she don't really ask for nothing. And she is very, very quiet. Oh, wow. Yeah. Very nice patient, and both of us have the same birthday. Yeah. Wow. What's that?
We had a wonderful attendance. Over 100 people showed up this evening to a wonderful event, and we were gracious and happy that everyone showed up in the community. The Westbury Village came in as well, and that was just a wonderful event. We had William from Excellent Home Care. We had John and Janine from Dr. Power's office. We had John Hardefeld, one of our clients, and his aide, Elfrida Play. We as well had Mrs. Carol Gregston and her aide, Etta Ramlal, that came in, and they were, just very happy to be here. I'm inspired to have a home health aide training institute to train clients. to train aides how to become good caregivers. In the world of aging, you need good caregivers. You need someone that can legally and, you know, professionally care for you and share from their heart the love of caring. Because as you age, you need care, and families and friends are not always there to help you, so you want someone that can come in with a great understanding of caring. And so we want to take that to the next level and show folks how to care, how to take that love in their heart to the seniors in their homes, in all the boroughs, including Nassau and Suffolk County, that would need care at home.
Hi, I'm Pastor Andina Jackson, Director of Public Relations here at Home Health Aide Training Institute. And it was such a dynamic pleasure for me to be able to coordinate this event for Maria Santiago, the staff and faculty of Home Aide Training Institute.